Hi, everybody. Welcome to Conversations with Calvin, We the Species. Uh, uh, I'm wearing a sweater today because it's cold. Last week at this time it was 80 degrees, and 3 days later it snowed. Now it's cold. It is what it is. Chronologically, we're at March 16th. This you'll be seeing on April 1st when this goes up. Um, this is such an important interview with OXANA Ali, who's in Canada right now. And I'll tell you why it's important, because she is Neuro-Dent and is going to talk about something that means an awful lot to me, neurodental advising, working with kids. And she's going to talk about, uh, as I said, on my own, I discovered because I like to do a lot of health things, as a lot of you people know. I'm 80 and I'm functioning at such a high level. I'm writing books now, often, and doing this and interviewing people all over the world. And part of my success story is I took real good care of my mouth, my oral hygiene, because I've read and I've learned and discovered, and we're going to talk about that. And again, it's just not known well enough about how important your mouth is to so much. They're now linking, I love how they discover things. They're now linking dementia and mental decline sometimes with poor oral health. And I think a lot of you know now that they've linked heart disease and hardening of the arteries, et cetera, with poor oral health. And I think they're at the precipice of making more and more discouraging of just how important this is. And what's really great about having Oksana here, because she does a lot of work with kids, and what's the best place? Where do you start
Yeah.
doing the right kind of things? Is with kids, putting them on the right path. Funny, I wasn't put on the right path. Who knew, back, when Eisenhower was president and Kennedy was president, that good oral health is going to last a lifetime. And it also makes you feel good up here. A lot of stuff. So who knew about that stuff? So I didn't know. So I paid the price for 20 or 30 years trying to fix up all those things that I didn't take care of. Now I do. And so I have to thank also, hugely thank Lorenz Tyson and Maria Zal. They're actually in Poland. And part of what they do, besides web services in the European continent, they also have influencer press here, public relations here in the United States. And Lorenz and I became friends, and it's been wonderful. We have a great partnership, and they refer and introduce me to people from time to time, as they've done with Oksana Ali. And I am so hugely appreciative to the work they do, and how they've helped me and influenced me. And so this is hugely important to you all out there and to your kids. And we're going to discover all these things about this uh, from Oksana. So my monologue is done. Oksana, why don't you say a few words and do your intro, and then we'll talk.
Yes. Hello, everyone. So, yes, my name is Oksana Ali, and I have background in dental medicine. I also mom of three kids, so I know what I'm talking about. Yes, and I also had very big challenge. I lost my husband, but I still believe he's with me, supporting me. And this event really pushed me, like toughly pushed me to go deeper in my research. And because before I had kind of, small puzzles here and there. And now I have like complete picture how it all works. Now it's kind of fashion to talk about like how it's everything connected, mind, body, soul. I actually spiritual person, and this is true because this is how I discover on my own. And yeah, and I'd like to share this knowledge because, you know, when you have knowledge, this is your power. If I knew it before, how it's all works, how it all connected, maybe my life would be more easier. But probably I supposed to live this way now to tell you about it because when it's everything started in our child, in our family, we as a parents think, you know, we just give food, we just give clothes, good education, and it's enough. But we don't really think how our emotional state affect our kids. And it's huge, huge, important stuff. I appreciate I have dental background because it's give me, I respect a lot science. I love myself a lot about neuroscience, but connected with something bigger, with spiritual stuff, with neuroscience, anatomy, and biology. This is how I discover what I'm gonna tell about. So this I'm here to tell your questions.
Okay. Okay. All right. Let's do some stuff here. Let's do some learning. Boy, is it essential and crucial that this kind of stuff is taught at such an early age because it just makes for such a better, healthier, happier life. And we're learning that stuff. And you know, I keep saying, you know, now we have AI to help us a bit, a lot, and it'll keep giving us stuff and teaching us stuff. But uh, um, we think we knew a lot, and I always say we don't know enough, and we don't know a lot. And I love when this stuff comes out a little bit here, a little bit there. It's like, you know, oh wow. As I've been learning about my mouth on my own, just how important it is. And I'm gratified in these last 15, 20 years of having wonderful dental hygiene, impeccable dental hygiene. You know, I go through mouthwashes, you know, about a gallon and constantly, you know. But anyway, so this is really important, and we're going to talk to Oksana now. Okay, so can you share what first inspired you to explore the connection between neuroscience, dental health, and holistic well-being? What first inspired you to do this?
Yeah, yeah. First, it's from science point of view. Yeah, you're right. Good hygiene, good nutrition. It's very important. Yeah, because again, head, neck, mouth, it's not separated from our whole body. All nerves or arteries, you know, they running everywhere. That's why whatever you have in your mouth, it affected for sure your heart because blood goes everywhere. And also, what inspired me? I have kids. I mean, mom who called me and asked, please, kids, you know, young, small kids, like they grinding bruxism, it's called bruxism. And I before, because of my science, you know, education in dental medicine, I mostly concentrated on symptoms, and it's great, it's good. But for some reason, it didn't work out well. for some kids. And, I start asking myself, why? I did about the same for everyone, but for some, yes, and for some, not at all. I never, ever, ever asked myself why. I just thought, okay, maybe they're not enough discipline at home. They don't do it, they don't practice because it's about my functional therapy, when you work with muscles. And, but again, because I trying to ask why, because I wanted to help kids and I wanted to help their parents. And this is what it came to me, emotional state. Emotional state. It's not about kids themselves because they're small, they're like sponge. We're so happy, when we go to another country or somewhere, and we're so happy kids learn fast languages. Go English, French, Spanish, whatever they're supposed to learn. It's fast, but they also fast absorb what is around kids. Emotional state of parents, and especially mom, because mom, they connected from the beginning, during pregnancy. Whatever they feel, they will pass to these small babies. And when babies come to this world, this is how it started. And some moms, they have, depression after delivery, and it's kind of okay because it passed, but it still affected our kids. They take it with milk from our mom, from us, as mothers. And it's sadly, and at the same time, it's when we know this, we can change it. I don't talk just to blame some mothers. I did myself not right stuff because I didn't know about it. 3 kids living kind of far from families and so exhausted, so many stuff, and especially kids one after another. And it was difficult. You're stressful, you don't sleep enough, all this stuff, like circle. Every day is the same, the same, the same. I'm sure many mothers can understand me. And you start blame kind of your kids, they don't sleep well, they cry all the time. But if I knew it, that if I can change my emotional behavior, my emotional condition, it will affect my kids.
Wow.
So they will cry less, they will become more quiet, and they will react differently. But because I didn't know about it, it was tough for me, really. So, and also it depends. I'm gonna tell about something about delivery. It also depends how baby was delivered, because we have bones everywhere, and we think bones, it's like, like wood. It's not. It's alive structure, and they breathe. We have different kind of breathing using our lungs, heart, and in head, our brain. It's our brain also breathes, you know, using crania sacral liquid. It goes from your head to your sacral. That's why this is named. And it's connected to our breathing, like from using lungs. So it's very complex. It's not just your mouth, it's not just your head, it's very, very complex. And when you understand how it works, you will change many stuff. And again, it's not about to blame somebody, just to give some knowledge that you can change it. And yeah, so this is how I start looking for my answers on my questions. And
Okay.
this is it. Yeah.
Um, how did your interest in childhood experiences and the nervous system develop into your professional work? How did all this come into be?
Yeah, we know nervous system. There's most of us knows a lot about it now because there's polyvagal theory, somebody against, somebody for this. But in general, this is how it works. There's sympathetic nervous system and parasympathetic nervous system. Sympathetic, it meaning it's when it's stressed, it kind of you turn on. Parasympathetic when it's relaxed. So, and sympathetic, even when you talk, parents talk at home loud, loud, with loud voice, it affects your kids. So the stressful, the sympathetic nervous system, it goes up. And so it's kind of your nervous system kind of sympathetic nervous system with polyvagal theory, it kind of closed because polyvagal theory and sympathetic parasympathetic nervous system, it's mostly about, many people now know about the vagus nerve. It goes from head
Right.
everywhere. And some people want to stimulate vagus nerve. And vagus nerve, it's not about sympathetic nervous system because it shut down. When it's stressful situation, vagus shut down. When you relaxed, when you relaxed, your digestive system work better. You can communicate because when it's sympathetic on, you closed, your breathing, lungs supposed to be open, but you closed because something going on. I'm talking about kids, yeah? And kids' mouth, our mouth, it's kind of part of this system. They can be also shut down when kids, just trying to go under cover and they don't talk. So kids start grinding our teeth and our mouth. It's kind of system that absorb shock, and it's good. But if it's too much pressure, it start working differently. People, kids, and mostly for kids, yeah, kids start grinding. Sleep with open mouth, it's a big problem because open mouth, it's also affect how teeth will develop in your mouth. There are now so many malocclusion, when bite not fit nicely, but everyone wants to have a Hollywood smile and everyone wants to fix fast and doesn't work this way. It's great we have orthodontist, but again, dentist and orthodontist, they work mostly on symptoms. They fix cavities, they fix whatever it's supposed to be fixed, but they don't look what is behind these symptoms. And I hope in future dentistry will be more open, more integrated, and look as a holistic approach, not just like too narrow. And I hope later we're gonna have dentist office and close it will be manual therapy because osteopathic it will help a lot osteopathic approach will help a lot. Maybe psychologist, because also, depends on how what kind of experience, first experience going to visit dentist kids gonna have, they're gonna bring this in future. So I don't know if I'm so sorry.
No,
I don't know if
I
I answer
know
your
what you're
question.
saying.
Yeah, yeah.
I know what you're saying. By the way, you talked about grinding, and 25 years ago, my dentist saw in me that I grind at night.
Mm,
So he gave me a bite plate, and I've been using a bite plate for 25 years.
yes.
I had to get sometimes I have to get a new one. My mouth changes, but that was so important for me that I don't grind when I sleep, and I think that's contributed to my dental well-being these days. That I don't grind, and I know you said that. Um, the other thing, Oksana, do you do you see or do you think that dental schools are changing the way they think and putting some of these things that you're talking about into their curriculum? Is that
I hope
happening
so.
yet?
Yeah, I hope so. They're supposed because now because of this time, a kind of crazy time with fast fixing, it doesn't work this anymore. We give medication, for example, for heart, but we don't look where it's come from. Kids have allergy. Kids have some kids has eczemas, but it's connected a lot to our nervous system, and we don't look at it, because I understand. I studied dentistry myself, yeah. So we pay a lot of money for this good stuff, and we'd like to pay back, this loan. So we need patience, and I don't go against dentists, but some of them, there's like, I know, they kind of try and find something in your mouth that you're gonna pay for it. And most of them, they don't interest at all why, for example, in kids, there's so many cavities. Why? We just fix it and buy. Yeah. But it's again about immune system.
Wow.
It's about saliva.
Yeah.
It's not about quantity. It's about quality. It's all complex approach, and we don't look at it, you know. And parents who don't understand about how it all works, they just pay because we trust diploma. We trust certificates. We trust people, who try to help us. But sometimes we need to know more in order to pay. You have to know why I'm paying this, what's happening to my child. And again, it's a lot about vagus. It's a lot about nervous system. It's a lot about neuroscience. Neuroscience is about emotions. It just and sometimes we think it just, suddenly, for example, kids can have, even parents can be everything good in a family, but something happened. Why this child developed this malocclusion? Why breathe using their mouth? It can be outside, it can be at school, some issue, but also I believe a lot about, I don't know if you heard word constellation. So it's also what our parents brought from, like baggage from their parents, and it's past. And now neuroscience talk about that, from Darwin theory, whatever saved, adapted well, they pass to the next generation. The same with emotions.
Wow.
Whatever saved before, life or something, they passed. But it was before. Now, for some reason, it can be turned on, but now it doesn't work. Sometimes we got in this cycle and we don't understand why the same and the same and the same. And yeah, it's called also epigenetic. This is it's big subject. I actually writing a book now. I hope it will be done by the end of spring, this spring 2026. And it's so huge subject. That's why I kind of, like what to talk. Uh, I'm gonna put everything inside. And it's mostly about parents because me as a mom, and it will help look at your kids differently. Look, first of all, at yourself differently. And I hope it will help. And also for dental professional, not just look for your client as a client who pay money or have insurance. Just ask more questions. So this is how I look at it.
Okay. By the way, the book, is that you're going to self-publish the book?
Yeah, I will. I hope. Yeah, yeah, I will. I will. Yeah, for sure.
Well, when we go off air, I'll talk to you about where you can get some help because I'm self-published 3 times,
Yeah, it's
and
great. It will be great.
it's
Yeah.
it's quite a journey, self-publishing. It's quite a journey, and I've been in this group. We'll talk about it off air. I've been in this group, Bold Authors Network. I talked to you briefly before we went on air.
Yeah. Yeah,
Uh,
you show me your books. Yeah.
Yeah, and it's changed my life around. And someday I hope I'm a guest on like the Jimmy Fallon show or Jimmy Kimmel show to talk about being self-published and what it means. And I might make people laugh because it's a rough journey, a great journey. It's a wonderful, wonderful journey. We'll talk when we're off here. The other thing I wanted to mention to you is about orthodontia. I didn't mention to you before we talked before we went on air. Uh, I had bad teeth, uh, and so in 1970, I was 25 years old. I had braces put on my teeth,
Okay.
um, and as it turned out, it saved my life, and and I'll leave it at that. And then things happened, it's funny stuff. It's not funny, but so I had braces put on my teeth in 1970. In 1973, I ripped them off myself. Long story, not now. And then I don't know, about 10 years ago, I had braces put back on my teeth. So, I'm 60, 65 years old. I'm wearing braces, and I'm sitting there in the office, uh, being 60 plus years old with, 15 kids who, are 10, 12, 14. And anyway, but I didn't do things the right way, obviously. And that's why I had to have braces put back on. Anyway, interesting stuff. And I actually wrote about my braces story in this
Okay.
book because it's quite a story. Not for now. But anyway, moving on.
Yeah.
Moving on. What are some practical strategies from your framework that the things that you're doing, practical strategies, the things you've learned and what you talk about that people can start to be doing now with respect to kids and education and teaching and making it a way of life.
Yeah. I just like to come back to your braces. Now it's more and more Invisalign. It's just difficult cases. Orthodontists use braces like metal stuff. Yeah. But our body, there's even book called Body Keep the Scores. I can tell you exactly the same for our mouth, for our teeth, because again, it's all connected. So sometimes, many times, it can re do relapse. You do your ortho treatment, very expensive, and it can back because teeth have memories when it was before. Also, when we fix, not good bite, we don't pay attention about tongue. Tongue is a big muscles. And to have nicely aligned teeth are facial muscles, and tongue supposed to be, like kind of nice wall and teeth between. But if it's weak, if it's tongue inside, it's not in good position, supposed to be actually up most of the time.
Well,
Yeah, this is can go back. Also, by fixing fast, this is, it's kind of 1 year and you're done. No, it's not. It teeth, it's like small articulation. It's like, we have bone, knee, we have elbow, it's articulation, our articulation. Yeah, this TMJ, it's also articulation. Every tooth seated in special place, it's also small articulation. So when you move fast, bones, they not to adapt. For our body need time to be adapted. So when you move fast, what can happen? It call root resorption. So like root can just be dissolved. It's but again, it's many stuff I'd like to talk about, but this is how it works. Again, just fixing symptoms without understand why this child in front of you fix, for example, bite, where's his tongue, how he breathes, if he's open mouth breather, like it's all many stuff. Then when you combine and you address this issue, can be work much more effective.
wow.
But if it's not, this is relapse. This is, that's why orthodontists now just kind of to guarantee their work, they put wire inside, like glue forever. It will not, shift it again. But if they remove, it will shift it. Why? Because the cause not fixed. We just look like it nice, smile, and this is it. And also because it moved fast and body, your bones not adapted nicely, it can affect your TMJ problem
Oh,
and create TMJ problem.
uh,
Yeah, and this is yeah. I'm sorry, too
no,
much
that's
about
fine. I have a long history with stuff. Um, and I write about it in my billionaire book. Back in the 90s, I was playing tennis and I fell and I I
yeah.
I hit my chin really bad, and they rushed me to the hospital and they said I was fine. They Panarexed me and anyway, a month later, I had such terrible pain in my
Yeah,
jaw.
yeah.
It was excruciating pain. I didn't, and finally, I went to a TMJ specialist, and he said, "You don't have TMJ. You have two broken mandibles. It was broken here, and it was healing the wrong way." So he said, "We got a couple of choices. We can break it again and kind of try to fix it, or we can wire you shut for 2 months." And so I didn't want him to break my jaw again.
Yeah,
So
yeah,
he,
yeah.
he wired me shut. By the way, that's one of the greatest people want to lose weight. The greatest, better than all the drugs you can take when you're wired shut. So I lost so much weight for those 2 months. It was great. It was also great for my marriage because I couldn't talk to my wife. Couldn't talk. So I used to grunt and do hand signals for us to communicate. And of course, I couldn't eat, obviously. Everything was through a straw.
Yeah.
Um, Interesting, and I write about that too in my book because it's funny stuff. It's not funny when it was happening, but funny stuff. And it's funny when I was having all those problems. That's when I met. I don't mind showing you when I wrote the story about the billionaire who I worked for 25 years. First time I met him, it was in a meeting. We had a manager's meeting, and I was in so much pain because I didn't know I had two broken mandibles. So I was actually laying on the floor because I took a pain pill. And when he arrived from Italy, he couldn't get to the front of the meeting, so he had to climb over my body, which was very painful when I realized the boss had to climb over my body because I was laying on the floor. It was kind of tough stuff. All right. Anyway, uh, before we go back to work, I have one question I always like to ask. It's a nice question. So here goes. Um, Excluding family or friends, somebody living or dead you'd like to spend a day with. If there is anybody, I don't know.
For me, it's always important family. Our kids, kids, it's kind of spiritual stuff, yeah. Kids choose their parents, I believe, a lot. Kids come to our family, to our system for a reason, to help us, not to fix, but kind of like tease, align nicely with whatever issue family has it. Any kind of, it's not about money, it's about emotional stuff, what we pass. Um, so kids choose us to keep to come here. But we'd like to fix them. They come for some reason to help us and they live their lives. But we decided, no, 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 no. We're gonna control, we're gonna do this, we're gonna fix you. But we are here to support and to give them unconditional love. We try to direct them to, okay, give them good education. It's important, like whatever environment they live, but force them to do what they don't want to do. I think it's kind of not good way to be with your kids. So for me, our kids are very important, and especially nowadays, when too much screen time, and if you give them freedom, they can live with this computer and phone stuff like all the time. So this is I'd like to spend time mostly with them when I'm free, but now I'm kind of busy with clients and also my book. I'd like to really finish it because I think it's important stuff inside this book, and it can help. Again, as I told you before, if I have this, if I had this knowledge before, it will be just different life. It's because we struggle, we don't accept it what comes to our life, and now through these challenges I can accept what comes to me, and this is kind of also aligned with law of universe, because this universe, God, absolute power, whatever you call, they know what is good for us because they try to, it's good to live day by day, the same, routine, nicely, but we are not here to live this way. This is kind of, you stay in the same field. If it's from metaphysic view, field, God, they need movement. They don't want something static. They need movement. And for them, there's no bad, there's no good. It's, like a Chinese Eastern sign, white goes to black, round stuff. It's about woman and man energy. It's about white, black, evil, God. But at the same time, it's all one. It's one circle. It's just transfer from one to another nicely, but it's all connected. But we as a people try to divide, like give name for this situation. It's all neutral. Lawyers, they look, they don't listen you like, oh, na 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 with emotion. They look like at facts. All happened to us. It's like fact, like just random stuff coming to you. But how we see, how we color, it depends how we observe, you know, how we see this word. And when we give these names, bad, good, for kids, don't do it, or whatever, it's kind of, it's not nicely. Because even, like we try to generalize people or subject or whatever. And I think in every situation, there's good and bad. In every situation, you can look even at bad from good side. It's there's always two sides, but depends again what we have in our family, how we grow up in our family. This is depends how we look at it. That's why my book it's a lot about what we can do for our kids, because our kids then they bring outside to school, to their work, everywhere. And this is it's huge for me. This is how I decided I mean why I decided to talk about it and write book, because it's a really huge impact in future.
Yeah.
And as we say, our kids, it's our future. This is how we have to really pay attention how we act, how we say, what is inside us, and what is important. Everything start in us, in me. I
Right.
can blame you, I can blame somebody else for something not happen or something happened badly, and this is how I saw. And but if you accept everyone how they are, because it's also even conflict. It's not for nothing. If you meet this person, even Carl Jung, they talk, we mirror each other. So we mirror, kids mirror us, then they're gonna mirror somebody else, And yeah, first of all, we start from us. I have to start with myself. Why? Even if I'm gonna have, for example, some conflicts about the same situation in different circumstances, but it's kind of the same. I have to ask myself, why? If people got sick, it's not about, oh my goodness, why I got sick. No, it's about why it's for, what I can do with it, how I can change it. Because if you go like, become a, start, oh my goodness, I'm so good person. Why it happened to me? There's always reason why. And by accepting, by understand what is for me, what I can do with it, it can help you just move forward. This is yeah.
Okay. Nice. Nicely said. Um, can you share a success story with a client or family whose life has been transformed through your methods?
Yeah. Again, I told before that I'm was looking before just at symptoms, mostly kids. Yeah, open
Right.
mouth, grinding, and I tried to give them some exercise, muscle exercise, or do kind of manual therapy. Now a lot on YouTube, but you have to understand the cause why. Without understanding, you can use all exercise, whatever you can look at YouTube, but without understanding why I have it. And many situations, they're just different. Every family situation have different whatever happened inside. And when you understand, it's not just about this kid, it's about what happened with your mom. I mean, his mom, her mom, yeah. It's about what happened around, maybe at school, maybe outside. And this is how you can apply. And this is, well, like really change. And especially small kids. When mom start doing something with herself, I mean, doing something like pay more attention to her, it will affect kids. Sometimes kids just don't need to do nothing. They will just observe newborn moms, they will observe and will change because our body, again, it's so smart, it's so intelligent. It just starts shifting itself because they know how it's supposed to be, you know. But we are so tough, it's like rubber. You try to, stretch rubber, but until point, this is bumps gone. The same with our body. We try to use it, push it until what? Something will break. This is how it works.
Okay. Um, what role does a childhood experience, and you kind of hinted at this, what role does childhood experience play in shaping adult resilience and leadership? So how much comes out from childhood into an adult? I guess a lot.
Yeah, because we not just learn from our parents. We not learn by words. I can smoke cigarette and I tell you, it's bad to smoke cigarette, but you just don't do it. We are example for our kids. And sometimes just without saying, they feel it. They feel it, our nervous system. They feel it, our emotion. They feel it, how we communicate. Even just, you can kind of somebody, for example, call to you and say, yes, this guy, but they feel it, how you pronounce, and if you do, you try to do, it's not easy. Nobody say it's easy. If you try to do applying love, and kids will feel it, will see it, they will observe this and bring to their life. Even how you can manage conflict in a family. You know, we all take from our family. And then when you go outside and you become leader, for example, and you can pay attention, not just, okay, we have to do plan, we have to, I don't know, like become biggest company, whatever you want to do, but when you pay attention to people you work with, when you pay attention how you resolve conflicts, and again, why there is a conflict? It's just different belief system met. My vision and your vision are different. But if we can, like see my side and my side from different point of view, it can help. But if we go right away, this is it, I told you, this is how it's supposed to be, it will never work out. And art of communication, art of, like resolve conflicts, it also came from family. And leader, it's not just about like, order, discipline. It's about, when you create company, you kind of, when you try to control, you will never have enough power, energy to grow this company. But when you kind of bless whatever you create, when you work with, understanding with people, and you will feel it, you will see it, how everyone can put something in this company, because by controlling your child, that your child become the way you want, it will just close him. We will never have good contact. The same when you become leadership, when you just do order, when you just give, like this way, it will never work out. You really have to listen, and not just listen, but you can learn how to hear. I can say blah, 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 whatever, but if I cannot hear what you really want to tell me, I think it's a problem. Becoming ambitions, it's it's good, but it's supposed to be in good way, like this is how I see.
I'm listening to you, and I realize that you're talking so much about childhood, and I realize that for 22 months, my son and daughter and granddaughter lived here until they found. Um, so I watched, and I impacted, and I spent such. As a grandparent, I don't have to work, and I can spend such quality time
Yeah.
with my child. I don't have to take care of a house. I don't have other responsibilities. I'm just a grandparent. So I'm interacting with my granddaughter, and then my grandson arrived while they were here. So today, looking at my grandchildren, I marvel, and I don't know if there's enough studies on this. What goes in, the input that goes into a
Yeah.
child comes out, and it may not come out today or tomorrow,
Sure,
but
sure. Yeah.
it
It's
comes
exactly.
out, and in just a very unscientific way. These 5 years that I've been hanging around my granddaughter, I see things that have been put in come
Yeah.
out.
Yes. Yeah. 100.
Everything. It's the most
Mhm.
amazing
Yeah.
thing in the world. What you
Yeah.
put in, you get out, and then some. Their own growth and their own learning. It is absolutely remarkable. And it just makes me think how important it is to do the right things for a child
Yes.
in this world. And part of the problems of this world is we didn't do enough right things and teaching and the whole everything, because it's what you teach and what you mold a child is going to come out, and it
Yes.
does,
Exactly.
it does. This It's pretty simple, and there are other things involved, but a big chunk, as I see the growth of these two children, is what they're getting, the love and the support, and
Yes.
um, and also uh, I grew up. It's interesting. I grew up in the 50s, and my whole source of knowledge was 16 books called the World Book Encyclopedia. And television was very limited. It was 6 or 7 channels. It went on the air at 8 and went off the air at midnight. And there was hardly any children's programming, I think, on Channel 13. The point being, I look at what I had, and now I look at what these children get, basically 24/7 massive input. And I look at my granddaughter, she's a little bit older at 5, but I look at her development and the things she's doing, and even her facial expressions and how she talks. Some of that comes from watching, Disney and good quality in Sesame Street and all this. Um, but I also feel bad for a lot of children who don't have that uh, access to good programming and good and stuff. But as I'm listening to you, I'm
Yeah. Yeah.
thinking
Yeah.
everything you're saying, I've observed in my world is really true. The whole childhood experience. Anyway, I wanted to say that because everything you're saying, I see it and I live it,
Yeah.
continually. Um,
And I just like to add now so many addiction. Why?
oh,
Because when kids don't receive much love and support, they run. Someone can run from home. Some goes to this addiction, to close door from the real life. They don't want to see it because it's too painful. No understanding, no support. And when it's kids become addicted, it's hard to get out of it, and we have so many now, services to help, but we don't pay attention what happened in a family, it's really huge impact. So then we don't need all these big services on this. It's great it exists, but still family, it's really it's huge. I don't know like how to explain more, but this one it's come from, it's like all our world, it's like web. And if something happen, some hole or whatever broken in one, it will affect whole web. The same if I push now, like push, yeah, it's all goes, it all will change position. It's the same, but especially now it's like, oh my goodness, so many, like it's going around. And even, I don't know if you heard about Gabarmate, he's Canadian physician. And yeah, and he talks also about addiction, about like kids, their development, but again, I combine, dental stuff, because how we, like how we live day by day in our family, it affects. It's not just about breathing, it's about heart, it's about like um, behavior of kids, so many hyperactive kids. Why? People like with minimum concentration. Why? People, like kids, aggressive behavior have. Why? And even like immune system, it's also about it. Cavities, it's about it. Uh, it's so many stuff, malocclusion, it's about it. It's so many stuff connected, and because we don't know about it, how you how you can fix something if you don't know how, you
Yeah.
understand?
Yeah.
And even, some kids, uh, school kids, they can wet their bed during night. Why? And it's also about it.
Wow.
It's all connected. It's
Wow.
all connected.
Wow. Complex.
Yeah, complex. It's really complex. Yeah, but
Really
we
complex.
decided, in this life, we have specialization in heart, specialization in kidney, specialization in dentistry. Great, perfect, but it's narrow. We have to look more wide, to really solve problems. We have to look wider. It's not just something small to fix. It's not about symptoms. For example, somebody has heart problem, medication, okay. And then after heart problem, kidney affected, because every medication has side effect. I'm not against medication. Sometimes really in emergency, they need it and they're helpful. But again, on long term, like we have to do, why chronic disease? Why? This stuff, it's all connected. And it's connected to dental stuff. We don't want our kids become just so disciplined. We need to give them, not freedom. I mean, freedom is good, but it's supposed to be with, it's not about, we have to also give, one of my friends, she's very religion, and she told me that there's kind of three types of know how you look at your kid. You can give a lot of love, too much. You're the best. You're the perfect, blah, blah, blah. And it's also not good. You can give like too much aggression and it's bad. You can give nothing. This is the worst. When you ignore kid, it's the worst what you can give. But you have to, like listen your heart and combine and never blame yourself. For example, today I was so tired and I just yell at kids and then I will not sleep all night. Oh my goodness, what I did it. This is how we grow. In conflict situation, we grow. In something we grow, we learn every day. And also it's kind of good. I practice with our kids at home. So before going to bed, we pray. Yeah, like whatever comes to you. It's not just, special stuff from Holy book, but thanks, thank you, gratitude, to show gratitude for the day. Because tomorrow you don't know, you never know like what it comes to you tomorrow. Like, thank you, what happened? I was happy with this day. It's not what I can change. So, and it's, they kind of learn, okay, and never blame. It's really, really big mistake to blame yourself, blame your kids, because this is how we learn. And it's supposed to be open, just this is how I see.
Okay. One more question to ask to um, kind of put things in perspective. Um, what are some of the simple daily practices to manage emotional baggage or chronic stress? So some simple things to handle this kind of stuff that you suggest. Emotional baggage, chronic stress. How do we deal with that on a daily basis?
Uh, First of all, stress itself, it's kind of good if it's short, because it's kind of push you. If it's a long term, it's bad and it's become chronic. It can lead to disease, and it's not good. But also notice every day, for example, if the situation repeated, can be different situation, but it's kind of there's repetition. You should ask yourself why. Why there's repetition and this whatever happened to you. And when you kind of have to notice, this what it gives me, like I become mad. So try to notice just a little bit. It's hard. It's very hard. Nobody said it's easy. But okay, example, I know I'm gonna yell if or whatever, say it loud. If it's, for example, I see dirt stuff, I don't know, whatever, something, you have to tell it's okay, I can handle, or you have to pay attention, not directly, because if you when you energy somewhere, it will develop itself. From science, I think it's like 4 seconds. If you stay in the same thought, it will develop. So if you change right away to something like, for example, starting count, like whatever, like colors outside, or just look at something like and really describe it. For example, I look now, there is a fish, it's yellow. So you go from something attached to you, when you become more, it's yellow, da da da, you start to describe, it will change. And then you can kind of pull down, think, okay, what I do next. You have to kind of pause, kind of, and use breathing, because when your sympathetic system it's on, it's become superficial breathing. I'm gonna kill everybody. I don't know, like oh my god. But if you become, it's okay, yellow fish, it's okay. So it's like when you see, you start to describe, and you become breathe differently. This can help you. It's not easy. It's not easy, but it can help. And when you notice, repetition, okay, this is something when I start to become mad, whatever, this is how you start. Feel yourself. Like notice what happened to your body before something developed like really big. Because we rush, because it's too much stress, it's too much stuff going around. We don't have time for it. React fast. But me myself, I don't like do meditation. I just don't like it. But walk, because tension, our muscle keep tension. And if it's stuck for a long time, it will somehow go out, and you're yelling, whatever, aggression, like fear. You have to go out. You have to move your muscles. You can dance. You can sing, whatever. You draw. Somebody like to draw. I like to dance. I don't I'm not professional dancer. Just like any kind of music, and you just like, and you feel like it goes, it releases, and it works. It's really, you have to move your muscle. You have to really change something right away. Otherwise, it will just finish bad.
Yeah, great stuff. This has been so interesting. And again, as I said in the beginning, when I first read about the things you're doing, and I'm saying, "Oh wow, how important this is," because I'm living it.
Leave
And
it.
listen, I'm living it in so many different ways. With children, seeing my grandchildren grow and learn and feel, and my own journey and my own health journey. How this is so important, and the right kind of training with kids, will help them have a better head and a
Yeah.
better heart and a better emotional outlook.
Yeah.
There's so much involved. So, hey, when your book comes out, let's talk some more about that because
Yeah.
half what I do, I didn't plan it this way. It is what it is. But half my hundreds and hundreds of interviews have been with authors because I'm an author, and I have this great bonding with authors. So it's something to think about when you come back. Any last words you wanted to say before we kind of sign off?
Yeah, because about hygiene again, yeah. We teach our kids how to brush nicely, but we don't teach our kids how to remove garbage from our head, from our heart. This is most important than just brush nicely, because as you told, it's a lot start here. Our nervous system, it starts here. Our vagus system, a vagus nerve start here. It's all inside our head. And if we can change something for ourselves, we can change for our kids. And this is for me, it's very important.
Perfect. Yeah, I just wrote that down. I don't know if you saw, I've been writing.
So, yeah.
No, I don't know. I've been writing as you're saying some things that I feel are important. I've been writing them down. So I wrote that down because I like it. So, thank you so much for your time and your passion, and your knowledge, and kind of sharing that with us. And I'm really glad that we got put together because everything you're saying, I buy into because I live it,
Yeah,
And thank you so much, Oksana. And
very
of course,
welcome.
you will. I hope you do come back talk about your book. And I'm just going to stop recording now. Don't leave. We'll do a little bit of a 2-minute wrap. Thank you, thank you, thank you.